So a little nervous about your new arrival. Well, it is a lot to handle. But just try to relax. Remember, there's only one thing you really need to know about babies. They can smell fear. So before we can actually talk about babies and subsequent emergency newborn care, we first need to briefly touch on sex. Because sex, as many of you all know, is actually an integral part of newborn resuscitation. And without a brief discussion of it, there's actually relatively little need to look at emergency newborn care. So as we look at this topic, the first question I have to pose to you is a simple one. And what that involves is age. Meaning, what is the oldest woman you've seen deliver a child? Most people typically it's in their late 40s, maybe even early 50s. And if you look at the high-risk infertility centers, so the places that they're doing in vitro and in vivo, they now routinely are having women, again, in their late 40s and early 50s able to conceive. However, if you look at the reputable medical journals, the oldest woman that I can find on record who conceived a child via in vitro was 64 years old. However, taking that to the other scarier extreme, what is the youngest child y'all have seen deliver a child? For me personally, it's 12. A lot of people I've talked with have said 11. However, again, if you look at the reputable medical journals, the youngest child that I could come across who delivered a child was 9 years old, which means she was 8 when she conceived. Hence the concept you remember earlier that everybody under the age of 90 is pregnant until proven otherwise. But what about if you've had a surgical procedure? If men have had a vasectomy or women have had their tubes tied, is that 100% effective? No. There's something out there called killer sperm that can and will swim through anything. So again, unless you show up at triage and you hand me your uterus, you are pregnant until proven otherwise. So the second question I have to pose to you is a relatively simple one. And that involves, do you have to have sex to get pregnant? No, there's definitely alternative ways, right? There's in vitro, there's in vivo. However, if you look at the reputable supermarket medical journals, as obviously I do on a regular basis, what is hands down the most innovative way to achieve pregnancy has to be this. Because a woman stunned the medical world when she was made pregnant by a bullet that tore off a Bosnian soldier's testicle before lodging in her womb. It could happen. But what we really need to focus on this afternoon is this simple concept of which I am a firm believer. I will stand pregnant women on their head and bungee cord their legs together and run for labor and delivery because they like to deliver babies up there. However, if you think about it, labor and delivery delivers upwards of 10 plus babies a shift. To them, this is not a stressful encounter by any means. However, as many of y'all remember, it's a true professional who can deliver a baby outside of labor and delivery. Now that's a woman. So in the event that the baby decides to enter this world on the expressway or in the elevator, what is your primary job? Catch. Because babies delivered for thousands of years before you and I entered healthcare, and the majority of them did just fine. So who's at risk for not doing so well? Well, certainly preemies. Moms that are sick, moms that do legal drugs, moms that do illegal drugs. What are FLKs? Funny looking kids. However, the OB department and the research will show you, you know what? You just don't know. Because you can have a mom who's up in OB who everything looks fabulous and the baby comes out sicker than snot. Concurrently, mom is standing on her head in a non-word breather, rushing to the back for a crash section of the baby's cute and pink. You just don't know till the baby comes out. Now, outside of labor and delivery, meaning in pre-hospital or in the ER, should you memorize APGAR